So welcome back. Good afternoon for those of you in America, and good evening for those of you in Europe, and middle of the night for some of the rest of you. But welcome back. So I'm here with Dr. Ozgur Yalcin, who is a schema therapist from Australia. He's actually a level one chairwork psychotherapist, and with Professor Rodrigo Trapp from Brazil, who is a level two chairwork psychotherapist. And it's interesting, we have the Southern Hemisphere is present today and actually going to be present tomorrow. That somehow, something about the gravity or something is bringing Sherwood to the South. I'm not sure what that is. I wanted to, I was thinking about the day, but what I had said a little bit, and then of course what Remco had said in his training, Rachel Abel had made some mention to it. Tobin had made some mention to it, which is schema therapy. And schema therapy has been a little bit, the spirit has been here, I think, throughout this day, even though we're not, well, Remco obviously is a schema therapist, and I'm a schema therapist of sorts. But I wanted to tell a story about the first time I ever saw Jeffrey Young, first time I ever saw him, period. So it was in 1991, and I went to a training at his center. He kind of joined the training at the end, and he gave a little talk. It was like half an hour on borderline, working with borderline patients. And I was actually still in grad school at the time, but before I went to grad school, I worked in a psychiatric hospital. And in the psychiatric hospital, and I worked in a very, classy, upscale, good psychiatric hospital. Borderline was not a diagnosis. Borderline was an insult. The hatred for borderline patients at that time was very high. Untreatable, unlikable, problematic, just, and I don't think that many really any effective treatments. I'm not even sure DBT was up and running at that point. But Jeff came in and he spoke about borderline patients with such compassion. It was astonishing. And he really said, they're not greedy, which was, I think, the psychodynamic understanding. They are little children who are needy, the classic idea that we now know. And I was just awestruck that you not only could like, but actually love people that most of us, were just like baffled by, or, and that stayed with me. That I could still see being in that room. This is like, 30 something years later, I could still see him there, and the funny thing was I then said, I want to work for this guy. I want to be part of this, So I sent him a resume or, CV every year for 9 years. And 8 years, he turned me down. On the 9th year, he gave me a job. Anyway, but I just wanted to kind of acknowledge, and for Jeff, I think imagery was really, at that point, he was the master of imagery. If you've seen those videos, you see it in the book, he wrote them out, but to actually see the videos live and the way he would present them, he would like tell you a little bit, he'd stop the video and talk for a while. You're like on the edge of your seats, what's going to happen with these people, but it was absolutely astonishing. And then the APA video, there are two moments, if you know that one with that woman, they're just astonishing moments, so it just the giant that he is, and the powerful work, and his spirit is with us here, today and tomorrow. Anyway, I just wanted to kind of anchor us a little bit in him, and also to have these two great schema therapists with us today. So wonderful and powerful. And a little of the boys club, I think we got going here, if I'm not mistaken. Boys club. Anyway.
As a matter of affection, we say, yeah.
So just to ask each of you, so how did you come to Chairwork? What have you? What's the journey or the story that brought you to this place?
Rodrigo, do you want to go first, or do you want me to?
Do you want to start us? Yeah.
Yeah, sure. So my journey started, I suppose, early on, obviously through schema therapy, understanding, sort of like the chair work aspects of schema therapy earlier in my career. But in 2019, uh, let me tell you about a story of a guy and a lady that I met in 2019 at an APS clinical college conference, um, who was Scott and Amanda, and I'd never seen chair work psychotherapy done in this way before. And as I recall, you guys, well, you did a beautiful dialogue with a person who was sitting with grief, had been sitting with grief for a long time, and it was just incredibly moving. And I thought, wow, that's amazing, right? That's amazing. If we can do this, and if we can get such movement and transformation in such a short period of time, like I want in on this. Like it was incredibly moving. And then in 2023, which is I think when you guys came and did the level one here in Perth, well then that just had me sold. I loved it, and I am very passionate, and it makes up a lot of my clinical work now, especially working with complex patients. It was yeah, it that's I suppose how I came into the fold, and it's a real privilege to be having this conversation right now. A couple of years down the track, and uh, yeah, thank you for the gift, I should say, Scott and
Well,
Amanda.
yeah, it's not our gift. We were given the gift. We're just passing it along. Yeah.
Thank you for sharing the gift.
Yeah.
So actually, to me, I started with chair work as a patient. Actually, the first time I did therapy in my life was in a psychodrama group. So we did a little bit of chair work too. But then when it was in 2019, actually 2017, I started my training with Joan Farrell and Ida Shaw in schema therapy. And we did a little bit of chair work, mainly with mode dialogues at the time. And then also in 2019, I saw Scott for the first time. I don't think he saw me because it was in an online training. I wasn't talking. It was an online training, and it was the first time I saw you working with grief too. Actually, it
Mm,
was with grief and guilt, and it
mm,
was so powerful, so moving that I wanted to learn more about the four dialogues and about chair work. So I did the processual cognitive therapy training with Irismar. He uses a lot of chairs too. And then I started to kind of following Scott and Amanda around the world, mainly in schema therapy conferences in Denmark, in Australia, in Brazil. Then I went to the US to do my certification last year. And that's it. And I'm very, very happy, very grateful to be here. It's so great to have a chair
mm.
work conference. I told Amanda earlier, it's chair work is in really good hands with you guys. So thank you very much. Yeah.
Thank you for that. So,
Can I just something just popped into mind when when you were speaking there, Rodrigo. The other thing that actually got me really, I guess, hooked was when we were at the level one training, and I think before lunch, Scott, you said, "Oh, I think you'd be. I kind of feel like you want to volunteer for the next chair work talk." I was like, do I remember volunteering? I suppose I have. Right. And so after lunch, I found myself sitting in front of Scott, and to my surprise, like in tears actually, which really kind of got me, and then I think that really internalized and solidified that for me. So that was a beautiful moment. Thank you, Scott. But yeah, it just reminded me of that.
yeah, well, I mean, to me, you were kind of a famous person because you had done, the YSQ. You had redone that. I knew who you were, at least by your work, because that obviously was a major, with Chris Lee, I think, right? That was a kind of
Yeah,
major
YSQR.
project that you did. And, you were talking to us, and I just, your energy was like, like this is a guy on fire for the eye. You could just feel it. And I also remember, not to reveal what you talked about, but it was very powerful on stage. There was a moment when as happens, giving voice, kind of the voice dialogue work actually, which
Yeah.
and tomorrow Bridget Dingle Gaspard is going to do it. She was our teacher, so you get to see the source of where we got that from. But you kind of went, and the tears came, and it was, and the pain and the wound. It was like, it was a privilege, very beautiful for me to see that. And so we obviously, there's a connection, that takes place when we do these things with people.
Yeah. That was a beautiful moment that we shared, that's for sure.
Yeah.
Thank you.
A private moment with 100 people in the room.
Yeah.
So, complicated question. And we saw with Remco, people were there earlier. So Remco saw me work before him, and actually very differently, I think, in the contrast. He had a couple of things were overlapping, and we were both working. He's working with a coping mode and the vulnerable child. I'm working with a coping mode and the healthy adult mode in schema therapy language, right? He goes for the vulnerable child. I tend to go for the healthy adult mode, but we're both wrestling with the issue of a coping mode that in some ways is problematic, right? So that was interesting, although the actual style is very different. But you can see, if you have the lens to see it, you see that structure. How do you think of chair work and schema therapy? How do you think of these two things integrated, separate, but overlapping? Either one, maybe Rodrigo, you want to start with that?
Yeah, actually, I think if we can think about the main objectives in schema therapy, like the general goals in schema therapy, like strengthening the healthy adult and take care of the child's needs and confronting the critic. I think chair work can do a really great job with all of them. You can use, you have the four dialogues structures, and you can kind of use them to accomplish all of these objectives. You have like some internal dialogues that you can use. You have giving voice, you have like relationships and encounters. And it's it's a great way to work with all of these parts, all of these modes. So I don't think is any goal in schema therapy that you cannot use chair work and the four dialogues to explore and to work with it. So I really like once you said something, Scott, about um like chair work is like learning to play the violin. So you can use what you learn to play Bach and to play Chopin and to play Beethoven and all of these musicians, composers. So I think that's something like it. You can use everything you learn in chair work and apply in schema therapy, have a great model to do it.
Yeah, I love
And
that.
what you're making reference to was, there was some, at times there was tension within the schema therapy world between what I was doing with chair work and what I was in the schema therapy world. And the issue was, and it's an interesting question, was they were saying to me kind of like, you're not really following the model. You're teaching people all these things. And my metaphor, which you caught on, was I think your chair work is huge and enormous. And I want to teach people how to do chair work, then they can apply it to schema therapy versus just teaching it within the framework of schema therapy.
Yeah.
For people who are worried about the sanctity of the model, this is a bit of an anxiety-producing behavior. So that was, I think, a polarity there, a dialectic that we were wrestling with. I think that's died away a bit, but that is true. I do teach these skills that you can then use it in the framework. And I think you're right. I think you can do it for all of schema therapy can really be, or most of it at least, can be done with chairs. But Oz, how do you see, or how do you dance with these two things?
So I was thinking about this, and I suppose coming from a different angle, thinking about it, how do we integrate these models, I suppose. And I think One way is for some patients, and it depends on how kind of fragmented they are and how much how much I get internal fragmentation especially with the complex patients. I'd still might give the YSQR to get an idea of the early maladaptive schemas, to get an understanding, and to get some, I guess, dialogue happening around some of those earlier experiences. And also, I really like using a mode map too. And so that I'll say this. There are like 1,000 modes. I think there are too many modes, and it's just way too overwhelming. And so we just kind of like focus on, really the vulnerable child modes, the parent modes, the compensatory modes, and the critic modes. I think they're probably enough. And there's, maybe eight or 10 that usually emerge consistently. And so I find doing like a parts map, a mode map, is really helpful because we're building a relationship with the patient because we're doing it together. And so we're building trust in the therapeutic relationship. And also, it helps externalize some of those parts for patients. So when we externalize them, they're less activating. And then we can understand their motivations and their history and their core beliefs and their what they um, what their function is and all of that kind of stuff. And then together we can also, I guess, decide where we should focus, like which ones, which modes are coming up most and
Mhm.
causing the most problems in that person's life.
But
So probably,
for people who aren't schema therapists, basically just saying you're doing a parts map a little bit, or explain, just use that language a little bit, maybe.
hmm.
Like you're drawing something on a paper or what?
Oh yeah, sorry. I was actually thinking but it was too low. I was going to send a photo or a photo of one, but essentially what you would do then is, you would have you would draw circles on a page, and have the patient to identify the different parts that they may experience, and it might be like a child part, there might be a critic part over here. You would have the healthy adult. You might also have like a creative, playful part. And so as the map builds, you can see all the different parts and their histories and it's a great visual kind of prompt for the person as well, because then they can take that home or take a photo of it and add to it. And um, yeah, so essentially it's a visual representation of the um, you uh,
Yeah.
of the internal working model, so to speak.
Yeah, I don't think you were here earlier, but Dr. Rachel Abel actually showed one because she uses it. She learned from Christoph Loos. So we see this kind of connection, of
Mhm.
creating a map, which is with adolescents. Um, Moving a little more specifically to chair work, I want to ask you guys parts work, giving voice, internal dialogues, maybe some examples of how you do this in your work or what has been useful or helpful for you in terms of dialogues, either giving voice to a part or encounters between the parts.
Yeah, I think one thing that maybe you can do, like since the from the start of therapy, is I like to use giving voice a lot. So it's a structure that you can really use since the first session. Like, okay, people start to talk about something, about an issue, and you can like hear some different parts. Okay, so you're telling me that you're struggling with this and this and this, but then you can hear together like a critic or maybe a coping mode or something like that. And you can use giving voice to just hear more from one of these parts. Oh, you said to me that you're not you're almost didn't come to the session today. So let's hear this voice a little bit more. You're kind of you're not sure if you're willing to do this or do that. Let's just hear each of these parts, so you can use from the beginning of the therapy. And it's usually what I kind of do with my patients. I start with giving voice, just to do what Oz told before, like creating a mode map that's a map that you can like use chairs to give life to this map a little bit
Mm.
after. You can like arrange chairs in a way that, like the coping modes stays between the child and other stuff, or the critic and the child are locked behind the coping modes or something like that. So I really like to start with giving voice and use like internal dialogues and other structures a little bit later on therapy on the process. And yeah, I think that's a way that works for me to start therapy. And then we have like all the other or a lot of other mold work you can do with internal dialogues, like interviewing the coping modes and know a little bit more about their history and why they're here, why they're now here in session, or why they're so strong outside,
Mm.
to know a little more about the critic, which critic is it, and to confront the critic, to strengthen the healthy adult. You can do all of these things with internal dialogues too. So I think these two structures are the ones I use the most with my clients.
Mm.
And I think maybe telling the story is the one I use least, or I use.
Oh, you're getting ahead of me. I'm going to come to that one later.
Oh yeah, yeah, of course, yeah, yeah. I'm sorry.
It's okay. So, Oz, giving voice, internal dialogues.
Hmm.
How's that been for you? How do you play with that? Anything particularly memorable for you with that?
Yeah, yeah, like I love what you were saying, Rodrigo. Like you kind of introduce the idea early on in the piece, early on in therapy. So I tend to spend a good chunk of time on my intake assessment. So I'll take two sessions at least to take history and build rapport and all of that kind of stuff. And um, what I find really helpful actually is introducing the language whilst we're doing that, whilst we're doing the collecting data and collecting information, getting to know each other. Oh, I notice, so there's a part of you that does this and a part of you that does that, and I just really just gently introducing it so that it's not such a foreign concept to them once we start talking a little bit about what it might be conceptually. And I suppose the other thing as well is, just thinking about that, I find that when the person is, I guess, fused with that part, when a part comes to therapy, it's really important to try and separate that part from the person, right? And so I would, if I notice that, then I would probably move to, a dialogue to try and find which part has come to therapy, whether it's the critic, whether it's a coping mode, or the over controlling modes, which are critic modes essentially. Um, this is my favorite. I love it. I spend a lot of time with this as well, and also, I guess while we're doing that too, focusing on how uh, we can strengthen the healthy part, the inner leader, the healthy adult. For some patients, they have it's very small or it's very underdeveloped, and so yeah, really trying to bring that in early in the piece too to try and understand what that looks like, and if there isn't any scaffolding around that, then we'll try and build some, especially focusing on you know. Uh, Future desires, or what like would like life to look like, how would you like it to be, what do you want in the future, and that can help build that part as well, so we'll try and do that at the same time. um, yeah, I just find it incredibly powerful and a great way to separate the person from the part, which can be sometimes driving them for days, weeks, yeah, a long time. And the relief and difference in, I guess, affect, body feelings is profound a lot of the time. I do have an example of just of a recent one where I did see this patient online because he's in another state. And he's talking to me about the frustrated, agitated part, and he's like, I don't understand this shit, but like it's all a bit weird to him, this part stuff, and but anyway, so I got him to move his chair over, and we started interviewing the frustrated and agitated part. And it's beautiful, it's beautiful what comes out, it's like, well, I need to protect this person when he feels challenged, when he feels threatened, right? It's my role to defend him. If I don't step in, he might be hurt and overwhelmed. And, like for the patient, like hearing this stuff is just so incredible because that all they know is a strong body feeling, and emotions, and these cognitions that just drive it. And so, and moving back, and he was having like some arguments with his partner and this kind of stuff. Uh, anyway, got him to, obviously move back and get grounded, etc. And then I saw him 2 weeks later, the other day. He's like, I don't know about that weird shit that we did the last time, but it was profound. It's
Yeah.
That's a good way to put it.
yeah, he's like, I haven't had an argument like with my wife, for a couple of weeks, and actually, she's suspicious of this because and what I realized as well was that she feeds off my energy, right, and how I am, and then she gets agitated, and then but if I'm not that way, then she's just like, I don't know. She was a bit mistrusting for a while. So it was really cool. And especially like noticing how different they feel in the different chairs. Like it's
Yeah.
chalk and cheese. How does it feel sitting there compared to there? Like, does it feel different? They're like, yeah, like I didn't want to sit there. Right. And then, but that's how you walked in today, right? Like that's how you walked into session today. So who knows how long you've actually been sitting with that for,
Yeah.
that feeling. Yeah.
Yeah.
There's this exercise I like to do a lot with my patients when you like ask them to create the image of their healthy adult on the chair, like I want you to see your adult, your healthy adult in this chair, and you can describe him to me, how he looks like and how are the clothes he's using, something like that, and some of his personality, things that you can see, and their body posture and their eyes and their expressions,
Oh yeah.
and then change chairs. Now you can sit on the healthy adult chair and you can be him with all of these things you just described me, like the expression and the body and the feelings and the personality and all that things. And from that, you can start like other exercises. Now that you're in your adult part, we can do other stuff like confronting the
Mm.
critic or taking care of the child or something like that. I think it's a good way to kind of charge the chair and the person with that energy that Oz was talking about, and creating like a more concrete image and figure of the healthy adult, not just an abstract
Mm.
concept or something like that, So I think it's
I love
So
that.
I think you're doing like, what Matt Peel's written about, other people have said, personification and embodiment, but you're really
Mm.
personifying probably
yeah,
more deeply than I would like, there's your critic, like, no, I want to see that, or I want to see that part, make
Mm.
it three-dimensional and then embody it in a real way. So that's really, that's
Mm.
a step I probably do not take very much, but that's really good. Do that. So we've been in the internal world, but moving to the external world, relationships and encounters, dialogues with other people. You both mentioned grief. I actually talked about grief a bit this morning. Um, experiences you're having in that world with other people, love, anger, fear, grief, loss.
You want to
Uh,
go? Yeah.
yeah, sure, sure. Um, so yeah, I find uh, this to be yeah, incredibly powerful. Um, an example came to mind of a patient who had been with who had a very abusive ex-husband, and they'd been together for a long time, lots of problems. They'd separated, and it had been some time, and then she started to experience nightmares about being attacked by this person, or that they were following them, and they were, going to come back in, and it was really terrifying for them. And so we did some, confrontation dialogues, interpersonal mistreatment, um, where her and I, sat and we helped with the coaching and stuff like that, where he, put him where she was able to confront this abuser. Um, and again, it's just a lovely way of externalizing all of this fear, shame, guilt, anger, and especially for her to be able to access her anger was incredibly powerful because prior to that, it's just fear. And when they don't have the opportunity to do something like this kind of confrontation dialogue, that's the thing that overwhelms the person. When they can access their anger and express it, uh, it now they can discharge it. They can give it back to the other person, and so we did this lovely chair dialogue. And there might have been a few pillows thrown as well, just for good measure. Um,
Right.
and yeah, and it was just incredibly moving. And the nightmares disappeared after that. So um, that's just one example that kind of came to mind for me with with relationships and encounters. I found, Scott. I don't know if others have found this, Rodrigo, but um, patients are the most reluctant to engage in grief dialogue than any others I've found. They seem to be the most afraid of it. I don't know if you found that in your experience, Rodrigo, or not, but uh, more willing to do every other engaging dialogue. But the grief stuff feels, yeah, people feel a bit more cagey about that. I'm not sure. We want to do it. We want to be able to do get them to obviously speak from their grief, speak from their pain, and do a role reversal, which would be amazing. But I find that people are
Yeah. I remember
reluctant.
the work with one patient that involves grief too, but kind of a different way. Uh, he lost his father about 2 or 3 months before this specific session,
Mhm.
and he got a job in a place that he kind of always wanted to, and it was the place that there he was studying from years to enter and to got this job, and he loses his father, and then he got the job, and he wants so badly to tell his father about what he accomplished, you know, and it was very sad and very heavy to him not being able to.
Mhm.
So we did a dialogue with his father. We put his father in the chair, and he could like tell him everything that was happening and how he was uh, willing to tell all of this. And then we did role reversal, and he could like listen to all that his father had to tell him, how proud he is and
Mhm.
how he already knew that this is happening and things like that. It
Yeah.
was
Mm.
very, very powerful, very beautiful. He after that, I asked him to move again, to change chairs again, and become him again, and close his eyes and take a moment to hear all of
Mm.
the things that his father said. And it was very, very touching, very moving. But I think it was easier because it was kind of a different part of grief. I think it was not uh, uh, like saying goodbye or something like that.
Mm.
That can be
Mm.
really hard to do. But it was very beautiful. It was kind of a moving moment for him to be able to tell something that he thought he was
Yeah.
never be able to do again, you know. So yeah.
Wow. I love that. Yeah, just even hearing about this stuff is just so moving, isn't it? Like like yeah, it's incredible. Mm.
The so what I've done at times um and the Gouldings are interesting people. They're kind of forgotten. I think they're kind of a precursor to schema therapy, but they can be quite brutal when it comes to grief work, because they are trying to break a connection so people are not trapped in loss. But so with romantic heartbreak, where there's usually it's a man I'm working with, so the woman is in the chair, across the way, and I go to like rhombic to two sides, and one side is, I'm the part that wants to say goodbye. You're not here anymore. I want, and saying goodbye is freedom. I always say that, saying goodbye is freedom. I get my freedom back by turning away from you, by letting you go, by
Mm.
blocking you on Instagram, and ending this. And the other side of, I don't want to let go. I hurt so much. I want you back.
Yeah.
Want you back. And I'm not, and I can't even imagine, this very painful
Mm.
polarity, of and kind of really pushing both sides to be more extreme. I kind of go, and I will push it to go like, I will hold on to you for the next 20 years.
Mm.
Like I will dedicate myself to you, even though you're not here. I want, that you're kind of playing it out because um, people do hold on to these things for a lifetime. I mean, not everybody, thankfully, but they do that. No, saying goodbye, as painful as this is my way, my path to freedom. So it's another kind of grief work. It's like, but it's very difficult, but very very powerful. And I think it's just we have thankfully we have a tool for doing this kind of work. This great
Mm.
gift of chair work to divide the heart in some ways and work with the heart.
Mm.
Or divide the other person is something that I was thinking about when you were talking. I remembered one demonstration you did when you split like the abusive father in two, because he was not just the abusive father, he was an abusive father sometimes, mostly
Mm.
when he drinks, but he was a loving father other times. And the person was able to speak to both of these fathers, and to kind of put the chairs in different distances, like
Mm.
I want this loving father closer to me, but
Right,
this
yeah.
abusive father I want
Mm.
far away, far away from me. And you said something at the end, like she was not she doesn't have to make a choice right now, but she has to be aware of, if she allows this father to still be in her life, she's allowing like both of them.
Hmm.
But you have to deal and kind of have your way to deal with each one of these sides,
Mm.
but you're allowing both of them in your life. And if you're breaking with him, you're breaking with both of them too,
Mm.
with the abusive and with the
Yeah.
loving one. So that was a great approach, I think.
Mm.
Yeah.
I'm laughing because it's great that you remember these things I've said because I had no memory of saying
Oh,
this.
Scott never, he doesn't remember the best lines he said. So I'm here to don't let him die, you know.
But I'm going to remember that weird shit you did was really profound. That one I'll remember.
But I'm keeping track of them. Yeah.
All right. Thank you.
Uh,
One, I think we obviously use this one less often in a way because it's more specific, but we do use it telling the story, kind of going through a traumatic experience or reliving. Any thoughts on that or experiences with that?
Yeah, do you want to go, Rodrigo?
You can go, yeah.
Um, well, what I really like about storytelling, and I think I probably draw on this uh, least of the other modes, mainly because if I'm doing trauma processing, I'll probably move more towards maybe EMDR or something like that. But if what I love about this is it's a really beautiful and gentle way of like prolonged exposure. Like that's how I conceptualize it, right? So, um, you know, you're starting off from a distance, third person, and I think we spoke about this, Scott, with Amanda as well. Maybe I'm not doing it in a way that is aligned with the model, but essentially starting, third person. Yeah, this is such and such, and this is what happened to them, right? And going through and being very gentle, pausing, and Amanda does this beautifully. This whole process. Um, and each time, obviously, more detail might emerge, and then, that kind of incorporates into the story. But by doing it in this way and by taking your time with it, I think by the time it comes to them telling it in the first person, it becomes more consolidated. It becomes a coherent story, and it's able to sit in the past where it belongs. That was a story from back then. That's a thing that happened back then. Um, yeah, yeah. So that's a really beautiful way of uh, and gentle way of trauma processing, I think. Yeah.
To me, I think is the hardest one. You know, for me personally, I think is the hardest one to do, and I think it's because, or some of it, part of it is because I think I'm more used to. I think schema therapy maybe approaches in a different way. Like uh, when we're doing imagery with trauma and with traumatic situations, we're connecting to the trauma just enough to activate schemas, and then we
Mhm.
stop everything and change the story and change everything so
Good.
we
So,
can.
Rodrigo, see, you're talking about imagery or scripting. So maybe just explain to the audience that may not fully understand.
Okay, yeah, yeah.
Love the mid-rear scripting as well. Yeah, yeah.
Yeah, imagery scripting is like when you're doing like an imagery exercise when you go back to some traumatic scene in your life, in your childhood or something, and you just want the patient to be in that moment uh again, just enough to activate their schemas. You don't want them to like re to relieve the scene, to
Yeah.
yeah, to relieve the scene.
Mm.
Um, you just want them like, my father is entering my room and I know he's going to beat me, so we're stopping the scene, we stop the
Mm.
image, and we change the end. You
Mm.
change the end by the continuation of the story. It's something that the therapist uh, take the child and take her away from home,
Mm.
or beats the father. I don't know, anything that
Yeah,
works for
yeah,
the patient to feel
yeah.
safety and to feel like um the trauma is not going to happen. I forgot the word, but I think I'm more used to do things like that, like just to activate the schema and then quickly go for safety.
Mm,
And when you're doing telling the story, it's a different approach. You kind of stay in touch with the trauma for a long time, and I think it's incredibly powerful and beautiful to see, and it's life-changing. I saw Scott and Amanda did quite some times
mm,
the this structure, and it's maybe the most powerful one in some ways, but I think it's for me it's the hardest one to like uh, stay with the patient for that long, knowing that what's happening and
mm,
feeling all of that again. It's the hard one for me. But the other way to do it, like telling the stories of the good things, you
mm,
know, this is the one that I like a lot too. Because you can like access another voice to tell
mm,
and to be the narrator of this story. And people sometimes had it's kind of difficult to tell things about her or about their lives that are not from the critic, oh, these things anyone can do. I'm just a
mm,
failure. It doesn't matter. I didn't accomplish anything in my life. Everyone is better. And when you start to tell the story from a healthy perspective or a
mm,
different perspective, I think it helps a lot to like
mm,
become part of their inner voice too.
mm. No,
Yeah.
that's awesome, Rodrigo. I love that. And I might actually, yeah, it reminds me. So when I think about like even things like EMDR and stuff like that, we think about like activating the memory networks. And by by activating the positive memory networks or the adaptive networks, of good experiences, contrary experiences to their traumas, and I guess get them incorporated into the healthy adult part. It really is empowering for them because a lot of the time they forget about that stuff, right? Um, forget about all that. I suppose one of the things that came to mind just now when we were talking is, also during the storytelling, which I kind of find sometimes happens with EMDR too, is there are sometimes positive aspects of the memory that come up that the person had completely forgotten about, right? So, there might be, I don't know, experiencing something where they feel trapped and that's all that the memory is focused on. But as you kind of unravel, tell the story kind of becomes more coherent. It's like, oh yeah, but actually I remember my friend Steve was there and he actually opened the door, and I'd completely forgotten about that, right? And so, or I remember something else, as there was someone else that came in, or something like that. And all of a sudden now that they're not alone. So then that's like really empowering for them, which moves away from the focal, worst kind of parts of the memory, to make it a more, yeah, a more coherent story. And I might, as we're doing the storytelling kind of thing, also maybe do some EMDR throughout it as well. Um, but one thing I remember, you said, Scott, I suppose about this whole process, which I suppose made it more approachable. And for me, anyway, was that you can play with this stuff. Like, don't take it seriously. Be creative, right? Like, and you got the license to be able to, this is a beautiful framework that you've created, but there's also license for creativity, right? And then that takes a lot of pressure off the therapist, right? There's shit I need to do in a structured way. And actually, no, you can just go with what your instinct is, what your feelings are, and you can draw on the other kind of, maybe skills from different things as well, while you're doing this. And so, yeah, I thought that was important. and important for, I think, therapists that want to do this type of work or learn it.
Well, thank you
There's
for that. I would note that it's Amanda who came up with the positive memory storytelling with a specific patient that she had that who minimized her own successes, you know,
nice.
Oh,
and so that it came out of a clinical moment for Amanda, and I think that's very beautiful. And
that's
yeah,
a level 2 secret, is it?
what's that? It's
That's
a
a
little
level 2 secret.
it's a little secret I secretly just revealed here for you guys.
Ah, what is it?
There were other things that Scott probably doesn't remember. He told us, but all these things you were saying us. I think 2 years ago, someone in Brazil was writing something about schema therapy techniques and things like that, and they asked me to write something about what not to do in chair work. You know, and I sent Scott an email. There's documented. Scott, you said that. Uh, I sent Scott an email inviting him, we're writing something about what not to do with chair work. And he replied me saying, I don't think I can really help you with that because I I will not suggest you to ever like put the patient in the chair of their abuser,
Yeah,
in any
yes.
way. But besides that, try it out, do things, see what works, what doesn't work.
Mm,
You
mm,
just have to try and see what's in it for you. And I think it's a great way to approach chair work. You
mm,
have those structures, and when you know them, and when you know what you're doing, you can really like be creative and be spontaneous. And that's a
I do remember sending that email.
oh, that's nice.
So I don't have a memory problem, just in case you were worried. So I think recently I know, Oz, I know you did this, and I think you did it also, Rodrigo. But maybe it hasn't happened yet. I'm not sure about that. But Oz, you actually did a training where I think you taught chair work to some people.
yeah,
I was
yeah, it
wondering
was
what it was like for you actually now playing that role of a teacher, and you did it also, Rodrigo, right? Or yeah. So maybe just if you're willing to share that a little bit because I think yours was very successful, Oz. I think you're very happy with. I think you did decisional balance or something like that.
yeah, yeah, yeah. It was really cool. I loved it. I was terrified, of course.
Oh,
Uh,
the rite of passage, the terror. Yes,
oh shit,
it
man.
stayed with me for
It
years.
was, and so I call it me, my modes, and I. Um, and so yeah, it was like the anxiety was like when you invite people to come to a birthday party and then like the terror of like no one showing up actually before the party starts. Anyway, yeah, it was really great. Like we everyone got so involved, and I did yeah, a couple of different experiential things. One of them was the decision making. Um, Dialogue of a lady who was looking to retire and was in two minds, and by the end of that, it was beautiful. Like some of her passions emerged that she kind of had hadn't really felt or focused on for a while. And then by the end of it was an easy decision for her
Nice.
uh, make a decision around that. And then I suppose the other thing that I've kind of integrated in there was, I guess, drawing in some different models as well. Like so, using some of the structural dissociation stuff and Janina Fisher approach, um, which I find really powerful when there's a lot of fragmentation inside and dissociation. And so I did a demonstration and then opportunity for them to do some try it, and then I did the decision making as
Nice.
well.
Good.
And yeah, and it was just the best part about it for me is, just sharing, like, resharing the gift, right? As we talked about right at the beginning, like, I want as many people as possible, like, to know, learn, understand this stuff, because it's just awesome, Um, yeah. So that
Good.
was my yeah,
And
and I've got another couple coming up now as well, which is great. I'm going to do one in New Zealand
I
in
saw you, New
October.
Zealand. Yeah, you're a world traveler already. You could be our competition in the Southern Hemisphere if we're not careful.
Ah,
Um, Rodrigo, you did a training or something, I think with Chairwork or something. If I
Yeah, sometimes I put some chair work in other stuff, when I have to like teach CBT or something like that. I hook
Sneak
a
it
little
in
bit
there.
and put some chairs in that. So yeah, I think it's always a little bit terrifying when we're doing the demonstrations, it's kind of good because it means that it's something that means a lot to you, and it's something great can happen,
Mm,
or maybe nothing can happen and you have to deal with that. But I usually do some decision making dialogues
mm,
too, and there were some nice stories from people in
mm,
demonstrations. Like once we did a future the decision making in the future, when you ask the patient, it was a student actually who uh, had to make the decision if he was going to keep working in the bank he was working, or he should leave and do something else. And we did some pros and cons list and use the chairs. And when we put him in the future, like 5 years in the future, he was going to be 40 years old in those 5 years. And he started talking about the side that wants to leave the bank. And he said okay, my name is John, and we're in 2030, and I'm 40 years old, and I left the bank. And he was talking to me about how was his life when
mm.
he decided in 2025 to leave the bank. And then he moved to the other chair, the chair that is the John that keeps working in the bank for these 5 years. And he started saying, my name is John, I'm in 2030, I'm 40 years old, and I'm still working in the bank. And when he said, I'm 40 years old and I'm still working in the bank,
Boom.
uh, something happened. He started to cry, and he started to say,
Oh,
what
wow.
I'm doing, what am I doing to my life? I
Yeah.
can't believe that I'm still working in this shit and I'm 40 years old. It was
Wow.
very powerful, very beautiful. Yeah.
Yeah, it's great. Uh, well, that's beautiful. Thank you. I'm going to bring the group in. I just want to say one thing that you might appreciate. So this may sound bizarre, but when I began doing chair work, I had nobody to watch. I
Mm.
did chair work and I was the only one. And it wasn't until Amanda came along, I was actually able to see somebody else do chair work. So I had no role models. So I carried a lot of anxiety. I think Amanda got a leg up because she could see me do it and kind of borrow, and you guys have seen us do it. So you can, so the anxiety level, I think, shrinks when you have these models.
Mm.
But it was like I had these thoughts, images in my head from the 60s and the 70s, but there was actually no one for me to see. So that was an interesting, kind of painful experience.
Yeah.
But
Terrible.
for the last, so thank you very much for this, by the way. This has been great being with both of you, and we could probably go on for another hour. But I
Oh,
thought
yeah.
we'd bring in the other presenters from today that are still here. So we'll bring back Amanda, bring back Rachel, Abel.
Mm.
I don't know if Tobin came back. Maybe he didn't. Oh, Rachel back in a minute. So maybe Amanda, you want to come back in and actually take charge of the situation? But thank you so much. And it's a lot of
Do you,
fun.
do you need an adult? Do you need,
Yeah, I do
need help?
Go
We
take
had
care
a
of the
big day.
situation.
Had a big day. Yeah, maybe next time we do this, we gotta coordinate our oh no, it's me. I did the schedule, so sorry. I gave you a big day. Yeah, thank you. Thank you all. It's really amazing to kind of get to know a little bit your background, how you're doing this work and you're doing it so actively and courageously in your own unique, innovative ways. And certainly, this gives all of us, Scott was just talking about role models. So you're giving us that as well as you're sharing with everyone. So, and this is how things grow. This is how expansion happens, right? And it's hard to be what you can't see. So thank you for giving us more to see and more to learn from. So, again, I want to open this up to everybody. I know that some people here have a schema-therapy background. Some people are coming from many other backgrounds. I think this is a less schema-therapy heavy event than usual, which is kind of great, right? We get more variation. So I want to invite, whether you're a schema therapist or not, ask us questions. You can ask Scott questions, Oz or Rodrigo. You may have all seen that I put in just a couple of articles in which they've co-authored in the chat there. And I'll send those again. And I'll also send their websites again. But just like all the other sessions, I've uploaded an article from each of them. Again, it's just a start. It's not the entirety of their catalog, but I've uploaded one from each of them to the session materials, as well as each of their bios and website PDF with their information, so that you can continue to speak with them, reach out to them, learn with them.
Definitely. Love to hear from you.
Yeah. So let me just find here in the chat. Whoop. I don't know where that went, but I'm assuming it's somewhere. Maybe someone else can copy and paste it again for me, because now I can't find it. I've lost the history, the chat history. So that's a fun trick. All
Well,
right.
I actually had a question for the group. I wondered what people, I feel like they've seen all these different people talking about chairs, doing with chairs. I wonder if, see if you get people's, some technical questions coming. Yes, you can use it in a group, and yes, the recordings are available in a few days.
Yes. So Chairwork was traditionally done in a group format. It's actually Pearls who brought it into the individual form, right? And now I'm mimicking you, Scott, because you usually answer this, but I've heard you answer it so many times. Give you a break. But yeah, so the creation of Chairwork by Moreno, he actually developed this in a group setting. He's doing group therapy, right? So that was the tradition is in a group. And then Pearls learns that from Moreno, and he brings it now into an individual setting, although an individual setting with an audience, right? That's kind of how he was able to be so renowned. So when we are doing our demonstrations, and when the others that you've seen today and ones that you'll see tomorrow doing their demonstrations, we're kind of tapping into that beautiful tradition of doing this with an audience, within a group. Yeah, so we are, I think, I forgot who said that, but we're standing on the shoulders of giants, definitely.
So one thing Pearls emphasized was, he said, he felt that, when you probably saw this today, when you see in the group setting, he's working with one patient, but there's so much identification, so much empathic resonance with what's going on in the chairs, that people are having vicarious healing. That was kind of his approach. He would do he'd do like 5-day trainings, so you're having that experience. We often emphasize, identifications and affirmations. We block people from, any suggestions, any criticisms. But if you are a group therapist and you're skilled, I think you should take this and play with it and adapt it. But identifications and affirmations are important. I think like with people like in addiction treatment centers, putting the drug in a chair, talking to the drug. And other people saying, "Oh, you talked to cocaine. Cocaine was just like that for me," or "Cocaine was totally different for me. It was like a different kind of person." So that way, I think the group can be really helpful. and great that way. And people remember these moments in these groups. They stay with people for a long time. So it's very powerful. The group dynamic stuff, I don't know. That's beyond my skill set. But that was how Pearls would do this. Actually, Pearls thought the group could take almost take the place of individual therapy because they feel there's so much identification and resonance. I don't agree with that, but it spoke to the power. Is that
And
helpful? Good.
Oh no, so just in group schema therapy, there's a lot of chair work too. Like you have a lot of people to help you to fight the critic, like 10 people fighting with you, or a lot of people talking to your child or the patient's child. So it's very powerful. It's very beautiful to work with chairs in schema therapy, group schema therapy. Yeah.
So you have the group talks to a part. Is that what to make it more common language?
Yeah, you like depending of which work you're doing, you kind of have all part of the group on your back, like one of the patients can do the critic. Maybe we usually use some masks or something to uh, something that refers to a monster or anything like that. And you have like all the other patients with you fighting that monster, and then you can like turn the mask and throw it away and things like that. But you have the group power with you, so it's a great way to do like internal dialogue with multiple healthy adults helping you.
That would be really cool, I suppose, I think more specifically for like a malevolent critic, I think. The part that wants to destroy the patient, Yeah, I tend to towards like trying to be compassionate to all parts. But then I think you do have that occasion of that malevolent critic who actually whose interest is just absolutely destroying and killing the patient. So doing something like that would be amazing, I reckon. That would be so powerful, especially for that type of critic. Yeah.
Yeah. I would also add that, I mean, very recently when we were in Brazil, this isn't the only time this has happened, but it's just the most recent in-person group experience that we had. We had a number of demonstrations where toward the end, the group became involved, whether it was taking turns one by one, giving verbal or, a loving touch or a caring touch on the participant's shoulder, right? Just to affirm a specific message, a healthy, caring message about themselves. So bringing in the group participation in that way is like if you affirm that this person is good or that they are capable, whatever it is, we invite you to come up to the front and, just touch them on the shoulder, or shake their hand. And also, Scott is very good at doing this. And he also will frequently ask someone, particularly if they're working with an inner critic, or if he's doing internal work with them that's centered on low self-concept or negative self-concept, and encouraging them to go into their own kind of sense of empowerment and being the inner leader, he will frequently have them proclaim to the room, whether it's 10 people in the room or 150, proclaim to the room, claim who they are and claim their power with all those witnesses. And much of the time, he will have them go one by one, at least to the whole first front row, and tell each person, this is who I am, this is my life, right? I am the inner leader. And really
that's so cool. Yeah.
So it's a very creative and beautiful way of involving the group, right?
Yeah.
But also we're staying within our capabilities, right? So myself and Scott, we're not group therapists, but that's a way we can involve the group that we're still sort of staying within what we can manage, but we're allowing the space for that element to come through. So perhaps if those of you who are here who are well-versed and skilled in doing clinical work in a group setting, you can only, continue to innovate that and really do that in a much more complex way.
I think that's a really good point that you made just then, Amanda, because like I've worked in psychiatric settings and done a lot of group stuff. And if you like it can be extremely powerful, right? I'm sure you guys have experienced this too, right? But it can also sometimes trigger off this cascade of discombobulation, right? It was, something said or something, and then people are dissociating and they're, splitting off or decompensating. And so I think like the skilled bit, I think is important, like to have a really good foundation in that already, so you can manage that stuff, and then utilize the best parts of it, right? Like by bringing all of those things that we've talked about. Yeah. There's nothing more terrifying than having a group just
Yeah,
fall
and that's
apart.
actually a really perfect. Yeah, you're perfectly bringing us into one of the questions in the chat, actually. So I don't know how you did that, Oz, but you just did that. It's like genius. So thank you. So Jess, hi Jess. They wrote, as a therapist wanting to do chair work but is hesitant and intimidated, I can think of several chair work techniques that could be used around the issue of doing more chair work with patients. Have you done that in training? So I think here the heart of the question is, I'm frightened, and how do I get over that fear, right? So one of the ways beyond practicing with yourself, practicing with other people, is to not abandon your theoretical model that you're already comfortable with, right? I am a chairwork psychotherapist, so I am working from the 4 dialogues model. That is my foundation. And that gives me a container to do many things. But keep your container and then bring the chair into the container versus in order to go to the chair, I have to leave everything behind. That's not true. So this is a wonderfully integrative, right? Whether you want to take this on as a modality or a technique. And part of that container is the grounding, right? So for us, we use the inner leader. Right, that's the true north. The person has an inner leader, they can do these other things, and they are less likely to decompensate. Right? But you can also modify this. You can do things for 45 minutes, or you can just do it for 5. Right, and Remco gave us an example of that this morning. It's negotiating with the patient, but also feeling out their tolerance level and their ability to contain themselves, and the window of tolerance. Right? Can we try this for 2 minutes? Is that okay? Yeah, Jess, I don't know if you want to say more about the question or your thoughts.
Yeah, thank you for the opportunity.
Hi.
Can you hear me?
Yeah.
Okay, awesome. Yeah, the thing I was thinking about 2 techniques in particular around my own personal ambivalence about doing chair work techniques with clients. And one of them was about the scenario with the decisional balance and like imagining in 5 years I'm doing the same thing as a therapist, or I'm doing a lot more chair work. So I thought that like that technique could be really powerful for me. And then that other inner critic basically would also address like hesitance or fear. And I thought this kind of dovetailed with the question of like doing this in a group setting, because I wondered if in your trainings you might do an actual demonstration with somebody that's experiencing that hesitation and ambivalence.
Should we do it with you now? Do you want us to do it right now?
I could. I have. I'm holding up my own baby, and so I think that might.
That's okay.
Your baby, not someone else's.
Yeah, my very own.
How odd to hold your own baby.
I want you to say this.
Yeah.
I'm Jess Williams. Say that.
I'm Jess Williams.
It's September 18th, 2030.
It's September 18th, 2030.
5 years ago, I went to this amazing Chairwork Psychotherapy conference.
5 years ago, I went to this amazing Chairwork Psychotherapy conference.
Even though I had a lot of anxiety,
And even though I had a lot of anxiety,
I said, I'm going to do chairwork.
I said that I'm going to do chair work.
I'm going to make this a part of my practice.
I'm going to make this a part of my practice.
And it's 5 years later.
And it's 5 years later.
And how's it going? How's your life?
It's really interesting. It's really interesting.
Your life is really interesting?
Yeah, my work is interesting, and I get to work with people around what kind of lives they want to lead and what's deeply important to them. And that always brings me back to those same questions for myself.
Now just move yourself like a quarter of an inch or something. Just move your body a little bit. Okay. And now it's September 18th, 2030.
Number
Okay.
18th, 2030.
I'm Jess Williams.
I'm Jess Williams.
5 years ago, I went to an amazing Chairwork psychotherapy conference.
5 years ago, I went to an amazing Chairwork psychotherapy conference,
But it seemed like it was too much.
but it seemed like it was too much.
I felt it was too scary for me to try this.
I felt like it was too scary for me to try this.
And I said, I'm going to put this down and find another way for myself.
And I said, I'm going to put this down and stick with some of the same old stuff I've been doing.
So it's 5 years later. How's it going?
I imagine the same sense of conflictedness.
Well, you are this. So how do you feel in your you are this person 5 years from now? You're feeling okay with that decision? You're happy with that decision? You found your way?
I am finding this hard. I think maybe what I'm finding is that like I still can be interested and new things have emerged, but I know that I've said no to something that really spoke to me on a deep level.
Yeah.
So if you move your chair back just a little bit somewhere between where you were before and where you are now. So what's the balance here for you with these two narratives, these two stories? 50-50, 60-40?
I think like, yeah, I think right now it is the wanting feels clear, the path feels clear, and then the how is what is the question for me.
Okay.
Yeah. And
you okay? I put you on the spot obviously a little bit, but
no, I appreciate it. Yeah, I'm okay. Yeah. And I think it's like no, I'm totally okay. I appreciate it very much.
Yeah.
And yeah, it feels to me like there's a lot more work I could do specifically using chair work around using chair work. And yeah, so I appreciate it.
It just tell you, so when I began doing this, including the first time I did it with Rachel, I mean, I had every stress symptom, for the 24 hours before that. I did the demonstrations. The last thing I did in the day, I put it off as long as I possibly could. I was terrified. I was frightened, but I feel like I have to do this if I'm going to do this. It's part of the condition you have to demonstrate.
Yeah.
A lot of fear. And every now and then I still get fear sometimes.
Yeah.
Patients. And I sometimes put a chair next to me. Nobody knows what I'm doing, but they will now. And that's my frightened child chair. And they say, you just sit next to me. We'll do this together. But it is scary. It is frightening. Everybody's been frightened. Amanda's been frightened. I've been frightened.
Yeah.
It's beautiful.
Right. Can I offer something? Can I offer something that I would with anyone that's kind of like doing anything new, like just own it. Like if a patient, like if but you're seeing a patient and then say, hey, listen, I learned some cool stuff recently. And do you want to give it a go? Like it might be a bit weird, I don't know, but maybe we could just see how it goes. How do you feel about that, right? And so just like maybe just take the pressure off yourself. Have a bit of fun with it and just be honest. And then that way, that way it might ease some of that anxiety around, giving it a crack. Yeah.
And I would add, that's great, Oz. Yeah, that's great. The honesty, right, helps so much. And I would add to that in that spirit, like in your spirit with that I tell my patients all the time, and I do this before I start a demonstration with someone. I don't know what's going to happen here. I don't know if you're going to make a decision, right? So if I'm doing decision-making work, other things, I don't know. But if we're in this together, let's just see what comes up. And that will give us more information for direction. If this isn't the thing, we're going to get something out of it. We're going to learn something at the very least. And that's enough. So again, I think echoing the sentiment from earlier, taking the pressure off, right? You're saying. And in practice, as you know, we have time with people. We have many months, many weeks, sometimes years. So we don't have to do it all at once. Yeah, I tell people all the time, I don't know. You want to see? Okay. And then
Yeah, let's just try it. Let's just have let's see how it goes. You want to try something? Yeah. And just do it, you know. A really a mentor of mine, would always say that if you go to any training at all, if you don't implement the things that you've learned in the first 2 weeks of the after you do the training, you won't use it. You won't bring it into your clinical work. And I think that was a really important bit of advice. Like, just get stuck in and have a go, and yeah, even though it might feel like a lot.
yeah, yeah.
Yeah.
I think Sophia has a hand raised there. I just want to make sure we don't miss her.
Hey, I just had one thing to add. Hi,
Oh,
y'all.
everyone. Hi, Sophie.
Hi.
Also, Sophie's a level 2 certified Chairwork practitioner, FYI. So thanks for being here with us.
Thank you for having me. My light's kind of funky because of the sun, but something that either Amanda or Scott brought up in our training last year was when you have a really ambivalent client, if they're really nervous, hold on. This is throwing me off. Okay. If they're super nervous, don't really make it into chair work. Just have them talking from that part in that chair. Or on the couch, however they're talking. And I found that was actually the first step for me to get comfortable with chair work, is not letting them know we're really doing chair work just yet, having them speak from that part. And then after a while, okay, I want to sit on that side of the couch. Let's talk from like the other point of view. And then we slowly brought out the chairs, but it got my confidence up enough to jump in. And then I also think for some clients, I did exactly what Oz and Amanda were saying, which is, I just learned this new thing. You want to try it out together. No idea what's going to come of it, but I have faith in you. You have faith in me. Let's see how it goes. Yeah,
That's great. Well, that's great. Yeah. Thank you for that, Sophie. It's kind of what a great suggestion. If you can creatively infuse this in kind of, if we're thinking in chair work, it's still happening in some way, shape, or form.
Yeah.
Since it's not about chairs. Right? No, that's great. Thank you. I think a lot of people are gonna now feel like, oh, okay, I can do it, and they don't know I'm doing it. You just opened up something for everyone here. Yeah.
So Rachel, why don't you join us? I think you're in the group there. Why don't you just come on?
Yeah. While she's joining us, I'm going to address Curtis's kind of a comment in the chat. So he's saying that it seems that Chairwork could also work with art therapy, right? Drawing other parts. It's funny that you bring that up because, hi, Rachel, welcome back. It's funny that you bring that up, Curtis, because, as we hope to make this an annual event, we have some great colleagues in Australia, Gemma and Yarrow, I think Starrick is the last name, and they have an art therapy center. And so they would be potentially, they may choose to present next year, and they would be able to address this question in full of how do you infuse art therapy, other experiential work, working with parts, chair work. So, but yeah, definitely drawing the parts and then going from that place.
Rachel, any thoughts or reflections about everything we're doing here?
I have to be completely honest with you. I've been coming in and out because I had clients to see. So I am sorry that I can't share that much, but I will say that coming in and out and seeing what's going on here is very profound because even though I don't know what's happening, it feels so powerful. And I just think it speaks to the power of chair work and how, effective it can be. So thank you.
And I will say it's great to see both you and Oz here at the same time, right? Because you have some overlap in specialty and interest and passion working with divergent patients and doing chair work with them. So I don't know if you may want to make a connection here, but I think again, we're covering now the northern and southern hemisphere here.
Yeah, let's connect. I'd love to speak to you more about it,
Yeah, that sounds
for
great.
sure. Hmm.
Mhm.
So there's a great clarity that just emerged in the chat. One says it's not about the chairs. The other person says, I want to go chair shopping. So yeah, it's all about the chairs. It's not about the chairs.
Well, I don't know if we're ever going to resolve that. Yeah. Let's see. When is our next level 1 certification training? So our certification training is only offered in person. And that is only in person because it's a much more in-depth, intense experience. And it's in-depth and intense on purpose, right? Because it is created, it's based on the journey that I went on in becoming a Chairwork certified therapist, right? I went on a very intense one-on-one journey with Scott. You know, he was generous enough to do this. But so it's only in person because it's a foundation so that if you wish, you can make this a core part of your practice or your therapeutic modality. So you can start that journey. We are in talks to potentially bring this back to Brazil next year. And we have been working on logistics for some time with Oz and with our other colleague, Dr. Lisa Chandler, in Australia for bringing this back to Australia. Right now, we don't yet have a calendar date set for when our next US-based certification training will be.
But the Brazil one is very likely, and we also will likely have an international component. So, you know, so hopefully Brazil is an amazing place, amazing people. So hopefully you'll consider that. We'll of course broadcast, let people know when the dates are, but that it's not finalized, but I'm pretty confident we'll do that. It'll probably be 3.5 days long in Brazil because the translation we do a little bit longer for that reason. But if you're English speaking, I think we'll find a way to make it work for you as well.
Well, if they're English speaking, they won't need a headset when we're talking.
Right. You know, Brazilians pretend they don't speak English when they do speak English, so there's also that reality.
Yeah.
So last words, Amanda. I think we're coming to the end of the day.
The pretend self, Bridget, it's great. The pretend self. So again, just like today, we're going to have a variety of speakers and presentations. As you have more time to reflect on the day's content, feel welcome to write down questions and things, thoughts to share tomorrow morning, or if there's any questions you have for speakers and you would like us to help get those to them. Again, we're happy to do that. We want to make it as easy as possible for you to continue to talk with and learn from all the presenters in this conference. So yeah, happy to do whatever we can to help to connect you or to transmit messages and questions to them. They're also very busy, but it is very heartening and affirming to have your work validated. So yeah.
Well, thank you, Sherry. That's great. Thank you so much for that.
Thank you. Yeah, so tomorrow we're going to start at the same time, same rhythm. We're going to alternate, straight up presentations, more workshop style, panels, fireside chats. It's going to be a variety yet again. So refer to your account dashboard for your links in the morning. And yeah, we'll get into things. It was great. Thank you all. And thank you to our presenters for today.
And thank you, BKTA, for the great tech support. You guys were great. So thank you for that also.
Yes, thank you, BK Event Production. We couldn't do it without you. We really couldn't. So thank you all. Okay, so we look forward to seeing you tomorrow.